Tuberculosis, or TB, remains one of the most persistent infectious diseases. Despite being preventable and curable, it still claims over 1 million lives each year. In this video, we'll break down everything you need to know about TB, from transmission and pathophysiology to diagnosis, treatment, and prevention. Tuberculosis is an infectious disease caused by Mycobacterium tuberculosis, a slow-growing acid-fast bacillus. While TB can affect almost any organ, the lungs are the most commonly involved, a condition known as pulmonary tuberculosis. TB spreads through the air when someone with active disease coughs, sneezes, or speaks. A single cough can release thousands of infectious droplets. When the bacteria enters the lungs, they are engulfed by alveolar macrophages. However, Mycobacterium tuberculosis is resilient. It can survive and even replicate inside these immune cells. The body mounts a cell-mediated immune response, forming granulomas, organized clusters of immune cells trying to contain the infection. This is what we call latent TB infection. The bacteria remains alive but dormant. If the immune system weakens, these bacteria can reactivate, causing active tuberculosis, characterized by tissue destruction and contagiousness. People with weakened immune systems are at higher risk of developing active TB, especially those with HIV, diabetes, malnutrition, chronic kidney disease, or those who are living in overcrowded environments. Healthcare workers are also at increased occupational risk due to exposure. Classic symptoms of pulmonary tuberculosis include persistent cough lasting more than at least 3 weeks, coughing up blood, fever and night sweats, unintentional weight loss, and fatigue and loss of appetite. Extrapulmonary TB can affect the lymph nodes, bones, kidneys, meninges, or other organs, producing a wide variety of symptoms depending on the site. TB diagnosis combines clinical suspicion with laboratory and imaging tests. For screening, the Mantoux tuberculosis skin test or blood test detects prior exposure. For confirmation, sputum smear microscopy identifies acid-fast bacilli. A chest X-ray often shows infiltrates or cavities, especially in the upper lobes. Additional tests like culture and sensitivity guide appropriate antibiotic therapy. Treating tuberculosis requires long-term, multi-drug therapy to prevent resistance and relapse. The standard first-line regimen, often called RIPE, includes rifampicin, isoniazid, pyrazinamide, and ethambutol. This combination is usually given for 6 months. Intensive phase is 2 months of all 4 drugs. Continuous phase is 4 months of isoniazid and rifampicin. Directly observed therapy, or DOT, ensures patients complete treatment, a crucial step to prevent multi-drug resistant tuberculosis. Prevention relies on early detection, treatment of active cases, and protection of vulnerable populations. The BCG vaccine offers partial protection, especially in children. Infection control measures such as good ventilation, masks, and screening of healthcare workers are key in preventing spread. Tuberculosis may be ancient, but it's far from gone. As healthcare professionals, recognizing, treating, and preventing tuberculosis remain one of our most powerful responsibilities. Thank you for watching, and don't forget to like, subscribe, and follow Vitals and Beyond for more medical educational videos.